Well, we know the prices of prescription medications and medical supplies just continue to climb, and for many families, these costs are adding a lot of extra financial stress. This morning, our Daytime Doc introduces us to someone who is really helping some local families save money when it comes to one life-saving tool. Here is Dr. Rogers.
Thank you. We've got a very interesting topic today, and that's the Epipen. It's been in the news lately because these little pens cost $600, and which is a way inflated price from what it was just 2 or 3 years ago. And it really hit me hard because somebody who's actually experienced anaphylaxis myself and spent the night in the hospital for it, it's interesting. This stuff is way too inflated. So I brought Steve Lane here, a well-known pharmacist here in Johnson City, to talk about prices of medications, why they're so inflated, how insurance has kind of come into play with it, and maybe we have come up with a solution to get this thing a lot cheaper. Steve, welcome. I know you've had a lot of experience. We all have to keep these around. Why is it so expensive? Why does it cost $600 for this?
Sure. Yeah. First of all, thank you for having me. And but there's a multitude of reasons. You know, it's just very complicated. You'll hear that said time and time again. But you know, often it comes down to everything from regulations. Often you can have the FDA involved, which in particular with this Epipen device, there was issues in trying to get generic equivalency to that injector device. So it held up the process. Obviously, the company took advantage of that window of time. They inflated the price. Literally from last year to this year, the price doubled. Generics are coming. Hopefully that'll reduce the price, but in the meantime, the patients, of course, are left holding the bag, so to speak.
From what I've heard, the generic version, which has been announced, will cost $300 instead of $600. Still, to me, that seems like a lot. I mean, I can't even afford to have these in the office. What I do, I have what you have in your hand is a little ampule of epinephrine and a simple insulin needle. I mean, if I was, when I go through this thing, there's a lot of steps even with using this simple Epipen. You have to open it, you have to take this off, swing it around, shake it, and then inject it. To me, if I had a patient here, I'm going to take out that little vial, pull up a little bit, and give it to them.
Sure.
To me, it's a lot simpler, and you can get that for about $10.
Yes.
Compared to $600, possibly $300 in the future. A lot of what I do in my practice does not rely on insurance. I'm trying to bypass that inflated, crazy price of insurance companies. Now, would you be able to market some of this and be able to, if I wrote a script, can you fill that for a patient to where they can get it for about $10?
Sure, we sure could. That's really not an issue. It's actually interesting from our perspective because this is the most common form of epinephrine that we use in the pharmacy, and especially through our long-term care pharmacies. And it's the exact same drug that you would find in the Epipen device. And it's fascinating when you look at it through that lens. Identical drug, yet you could buy this for under $10 and then $600 for that. But that just goes to show you the type of market manipulation that's going on.
So I think for an educated patient, they can flip that open, draw 0.3 cc's out, which will have marked on their thing, and they can actually come in here. I can show them how to use it.
Sure.
I just want them to save all that money. It just really irked me to see the price of that Epipen and to see some of the CEO of that company getting a $19 million annual salary, and we're actually ripping the public off. So I think a lot of what we do in healthcare is just skewed. It's really messed up, and that's our goal, is to bring it to an affordable, reasonable price.
Right, and I couldn't agree more, and that's how we feel like that we could help at ProCompounding Pharmacy in particular, is that we could literally package this, have 2 ampules of the epinephrine along with 2 syringes, even alcohol swabs. It would come in a brown bag because it does need to be protected from light. But the same dose that you would use for the Epipen, you would literally draw up just out of the ampule, and you would inject that subcutaneously, no different than the Epipen. And you could literally have all of that within a package for probably $30 or less. So at least it's an answer in the interim until the generics do arrive and bring on the needed competition.
That's amazing. I'm really glad we got to talk about this. We'll try to talk about more of this kind of thing in the future. Thank you for listening.
The preceding portion of Daytime was sponsored by